Well, good afternoon once again, and welcome to Evergreen Talks. We are with you on both the Evergreen Facebook and YouTube channels for today's Evergreen Talk. As you can see, Stacie Hanna is going to be our provider today, providing information on breastfeeding in just a moment. But first, every second Thursday of the month at 4 o'clock is our Evergreen Talks monthly Facebook Live event where Evergreen physicians and providers and specialists provide and present topics that matter to you. And we always want to send people to evergreenfamilymedicine.com for more information about what you see today, or if you want to learn more about the providers at Evergreen or see our newsletter and all the work that is happening there, please check out evergreenfamilymedicine.com for more information. Well, Stacie, nice to see you again.
Yeah, you too. Thanks, Brian.
I am looking forward to hearing and seeing all about Breastfeeding 101 today. That kind of sounded wrong. I'm not really in the market for this, but I do know how excited you are about this topic. And as a midwife at Evergreen Family Medicine, this is something that you are very passionate about. So I'm going to step aside. I'll slide the slides when it's time. And I'll turn it over to you.
All right. Well, if you learn a lot, Brian, I am always looking for extra help, so I could probably get you a job if you need. But so yes, I'm Stacie. I'm one of the nurse midwives here at Evergreen, and I'm really excited about this because within Evergreen, within our women's health practice, I have started a breastfeeding clinic. So this is fairly new. We're still kind of, finding our way in terms of the logistics and whatnot, but it's been really successful and it's been a lot of fun too. So I really like this first slide because I just like the saying, this is new to you, this is new to your baby, and both of you are learning this journey together. And it is so true. If you've never done it before, or even if you have, and each baby can be a little bit different, and so each experience can be a little bit different, and sometimes that can be really unsettling and a little overwhelming and scary, but that is what I'm here for, to hopefully help put you at a little bit of ease. So we'll move on to the next slide. So I just wanted to take a minute and kind of touch on breastfeeding and public health. So this, of course, is not a new thing. This is not something specific to the US only. And so I really like this photo because it shows you, in terms of all over the world, how many people are still breastfeeding. And so this specifically was at 12 months of age. And the countries highlighted in the dark green are actually, the darkest of green is 100%. So in a lot of Africa, you can see that 100% of babies in these areas are still being breastfed to some capacity at 12 months of age. And I just think that this is really powerful. And when you look up over at the US, we're kind of in the more 20 to 30% range. So there's definitely a lot of work that we can do. In these other countries too, breastfeeding was and is a public health priority, and it didn't start really becoming something that was really pushed and supported in the US until the 90s. Improving breastfeeding duration and exclusivity has been linked to, good outcomes, of course, between the feeder and the baby. And we will actually get into some of those benefits a little bit later. And then exclusive breastfeeding for the first 6 months of life is truly recommended. Of course, there are always exceptions. Here are, like PKU, metabolic disorders, things like that. And so this is not, there's definitely exceptions. So we'll just keep that in mind. But next slide. Okay, so just kind of the basics. How do we even make breast milk? So a baby suckles at the breast, and then our body releases two hormones, prolactin and oxytocin, and those get sent to the brain for this whole cascade of events to occur. So prolactin is what allows the milk to be made, and then oxytocin is what actually allows the muscles and the milk ducts to contract and move the milk. So when you think about, most people think about oxytocin as in that feel-good hormone, but one of the benefits of it is it causes things to contract, like in labor, uterine contractions. And then Pitocin, of course, we all know what that is, but that is a synthetic form of this natural oxytocin. And then when this is happening, the baby then, as they suckle, will pull the milk out of the ducts and through the nipple. And then in terms of just making milk, the more you nurse, the more milk that you will make. So whether it be pumping, nursing, because your body goes, uh-oh, the breasts are empty. I've used it all. I need to make more. So I always like to say empty breasts make milk, and you can't put, if you're not getting the milk out, you can't put more in there. Next slide, sorry. All right, so milk comes in 3 phases. And milk is actually, it's really interesting because it truly changes based on what your baby needs and how it's growing, developing. So the first milk, colostrum, we all have heard about this. It is a very nutrient dense golden substance, and our body only makes milliliters of it. So it makes a very, very small amount, but it's really concentrated. So the baby doesn't need a large amount. We'll also look a little bit later at some photos of the size of your baby's stomach. So that can also explain or give you a visualization of why the colostrum is so small. But it's high fat, naturally has a lot of immunizations to it. And this is typically in the first 3 to 5 days, kind of depending when your milk comes in, that expression. That usually happens, again, around the 3 to 5 day mark. Sometimes it can be a little bit later, depending on how maybe your birth went. Emergent cases sometimes end up, or if you lost a lot of blood or things like that, it may come in a little bit later, but typically around days 3 to 5, and then up to day 14. So I talk a lot with patients about, establishing your milk supply and the importance of the first couple of weeks. And you can see here, because that is this transitional stage of when your milk is coming in. So those first 2 weeks can be really, really important in long-term breastfeeding success. Here, though, you find that supply does bump up. You make about 100 or 500 mils a day, so half of a liter in a day of breast milk during this time period. And then mature milk is after those first couple weeks, so supply is established, and that is the mature part of it. And then it's enough in terms of substance and everything in it just to supply all the needs that your baby needs for the first 6 months, to be exclusively breastfed for the first 6 months. And it continues to change. And one of the most fascinating things about it is that if, say, your baby develops a cold and your baby's breastfeeding, the baby will actually send bacteria, virus, whatever it is, from their own mouths into the breast. Your body will recognize that and then build up antibodies to it. So that way, when you then continue to breastfeed the baby will actually be getting some additional antibodies. So it's pretty cool. Okay, next slide. So just some newborn feeding cues. And this applies to, breastfeed, bottle feed, whatever, the baby will very obviously demonstrate some signs that they are ready to eat. So opening a mouth, of course, is a big one. Sticking a tongue out. You see a lot of babies, they look like they're kind of trying to taste the air around them. And then rooting. And so what that means is, if you ever see a cute baby and you go, oh, and you just kind of brush your hand up against their face, they will often turn their mouth towards your finger, or towards your shoulder, or anything. And then sucking on hands is another sign that your baby might be wanting to eat, trying to reach further, whatever they can, into the mouth. And these are all really important to notice, because these are what we call early feeding cues. And so this is the ideal time to try and put your baby to breast. When a baby cries, it is a late sign. And so by the time, if you wait for your baby to cry, not only are you potentially missing feeds over the course of a 24-hour period, but the baby can be stressed out and then not want to feed as well. which in turn stresses you out, and it kind of creates this whole cascade of events. So if you do find that, oh no, the baby's crying, then the best thing to do is really try and calm your baby first before attempting to feed. All right, so latching your baby. So I've been trying to think of a clever, catchy song, but I have not gotten very far. And I think about it a lot, actually. But, I always tell patients the first thing you need to do is put your baby tummy to tummy. So you and your baby, and it doesn't matter what position you're feeding your baby in, tummy to tummy is how you want to start. And then nose to nipple, which means, and you can see in kind of the first and second photos there, you want to line your baby's nose up to your nipple. And that seems kind of weird because naturally we want to line the nipple up to the baby's mouth. But what actually happens is when the nose, so I actually have a baby and a breast to show you, but it is kind of hard to demonstrate here. So when you line up the nose to the nipple, the baby actually rocks their head back. And then when you bring them in close, they will bring their mouth right over on top of the nipple. So, so tummy to tummy, nose to nipple, and I'm still working on the rest of the jingle. But and then a little bit about this. They kind of talk about sandwiching the breast. You don't always have to do that. It kind of really depends on the shape of your breast. So that's not something that necessarily needs to always be done. But then checking the latch. So baby's on. Now you want to make sure that they're on correctly. So it is important, and you can see on the bottom photo there, the baby's lips are really open wide. So it's like a 120-degree angle. And that is really, really important because if the latch is shallow, of course, you're going to have, you're not going to be productive in the long term, and it's going to be really painful. So it is important to check the latch. And sometimes you have to kind of pull the bottom lip down, top lip up, and kind of reassess and go from there. And then ways to assess milk transfer. So when we talk about milk transfer, that means that not just that the baby is suckling at the breast, but that the milk is actually going from the breast to the baby. And so you can see if the jaw is open wide, regular sucking, it should feel like a really deep pull, not a sharp. And we'll get into on another slide too about proper and improper latches. But then the biggest one is you can hear and see the baby actually swallowing. Next slide. Okay. Oh, so here we are. Good latch, bad latch. So you can see in this first photo, the baby's head is tilted back a little bit. The baby's chin is up close right next to the mom's breast. The mouth, you can see that really nice wide angle. And you can't see the tongue here, but the tongue is actually forward and down a little bit. But one thing that I like to point out, because remember we talked about putting nose to nipple, is you can see here a lot of the areola on top of the photo. You don't see a lot of the areola down underneath the chin. And that is really important. This is called an asymmetric latch, and this is how it should look. So if you look down and you see, oh gosh, I see equal areola on the top and the bottom, then there's a good chance the latch may not be correct. Then signs of the bad latch. So number one, pain. It hurts. Usually people complain about it being sharp and painful in that way. And then lips rolled in or circled. So I talked about that a bit in terms of checking the latch to kind of check and make sure the bottom lip and top lip are pulled and not rolled. Babies instinctively, like all of us, will kind of try and find the easiest and laziest way of getting the breast in. So sometimes they will suck so fast that then they just curl their own lips in, and which of course is not correct. The sounds of clicking or smacking at the breast. So that usually means the tongue is doing something weird in there, and the tongue should be rested nicely underneath and not moving around, clicking all over. a sensation of biting. So some babies do tend to kind of compress and bite down a little bit. But if the latch is correct and the mouth is opened appropriately, then they won't be able to do that. And then the nipple slipping out when the baby pauses. So if the latch is deep enough, there will create a very strong seal and suction. But if you notice, every time the baby sucks, it's like nipple out, then it's in, then it's out, then it's in. Then that is definitely not a good latch. And then, of course, bleeding or injured nipples. And, you know, this it can be really tricky. Breastfeeding in general, especially when you start for the first time, you're going to be a little bit sore and uncomfortable, but you shouldn't be bleeding or to that point. That would be extreme. And then another bad sign, of course, is that the baby's just not gaining weight. So baby seems to be suckling a lot at the breast, but not gaining weight, which tells us that the baby is not transferring that milk from your breast to them. So next slide. So this is just a few different positions. Of course, the number one there and the number two, the cradle holds tend to be the most popular, the most just kind of natural. But sometimes depending on your own anatomy, depending on various things, we got to try a different position. So there is the back lying, or the football is really popular. I really like the Australian hold, and especially for people who tend to have a very forceful letdown, the Australian hold and kind of the back line can be really helpful and give the baby a little bit more control to kind of help prevent some of the milk from less forcefully going down. And then side lying is really great, especially when you and your baby are snuggled up together in bed and you're feeling kind of sleepy, like you inevitably will. The side lying can be really nice. Next slide. Okay, so I really like this photo because it shows you how the size of the baby's stomach will change a lot in just a matter of a month. So, when we talked about colostrum, and your body makes just milliliters of colostrum. So the baby's stomach only fits like 5 to 7 milliliters. So this is tiny, tiny. And I don't know what kind of fruit that is, but it's very small. But I have kind of a visual here. So if you think about it in terms of like, I don't know, I guess in terms relation to this baby. So this is just the size of the baby's stomach on day 1. So it's very small. Day 3, of course, that's when your milk is starting to come in. So baby's stomach naturally is increasing. And then by 1 month, their stomach is already the size essentially of an egg. So usually, you might be making way more breast milk than they need, but their stomachs, of course, will continue to grow. And then it is incredibly important for establishing and maintaining that milk supply that in a 24-hour period, you are feeding or pumping 8 to 12 times. So we tend to get in kind of a, feed your baby every 3 hours or whatever it might be. And babies don't eat exactly like that. Some do, but not all of them do. And there will be periods of time where you might have your baby maybe wants to eat every hour for a little bit, or then they want to have a 4-hour break later. And really, it's not about really what you should focus on the number of times in the 24-hour period. So 8 minimum, but at least 8 to 12. And then in terms of feeding length, each baby feeds a little bit different. Some are very ravenous and they will feed very quickly. And some kind of have more of a graze approach, and it may take them a full 20 minutes or so to eat. So anywhere between 5 and 20 minutes is fine. And one way that we can watch or monitor that is, of course, the number of wet and poopy diapers they have. So in the first 24 hours, we just expect them, or, around the first 24 hours, to have at least one void and one stool, so one wet and one poopy diaper. But by day 4, so this is when your milk should really be, finding its way in, then they should be having 4 or 6 wet diapers, 4 stool diapers. And then a big indicator of if your baby's getting enough is they look happy and content after they feed. So when you are breastfeeding, of course, you can't tell. You don't have a little measuring gauge on your breast to know. But babies will initially start to feed with tight hands. They're kind of clenched. And then as they become full and content, their hands will actually soften and open. Their bodies get very soft. They just look very, very rested. And then your breasts will feel softer. So you can always spot a breastfeeding woman out and about because she'll randomly go and grab her breast to feel what her milk is doing. And so you'll actually be able to feel afterwards that yes, the breast is softer. And then of course the baby's gaining weight, and which will be monitored at the pediatrician's office. So some of the benefits that I mentioned that we would talk about. So maternally, after delivery. So remember I talked about the oxytocin and prolactin hormones that start when, or that send the signals to, or oh my goodness, signals get sent to your brain to release these. And so that's really important immediately after delivery because your uterus went from this big old like kind of watermelon size. The baby comes out and now it needs to contract back down. And so it takes a couple weeks for, of course, it to go back down completely. But initially, we need it to shrink as much as possible to prevent you from having postpartum bleeding issues. And so when the baby nurses, the oxytocin, those natural hormones, cause not just the breast to contract, but also your uterus. So it can be really helpful in that. And then reducing the risks of breast and ovarian cancers is a big one. Reducing for moms maternally type 2 diabetes, high blood pressure, postpartum depression, and actually is the stress reduction from oxytocin, feel good, hormone, and prolactin. And then, of course, just that extra bonding time that you get with your baby when you are feeding 8 to 12 times in a 24-hour period. And then for baby, it's pretty incredible. Reduced risks of asthma, obesity later in life, diabetes, respiratory problems is a big one, GI issues, better visual function in preemies, which is pretty fantastic, and then lower rates of infant mortality like SIDS. So really, really good stuff. And so if, knowing just how great breastfeeding can be, then why do people stop? Like, well, why is it so difficult? A lot of moms are worried, hey, I don't know if my baby's getting the milk that they need. Because like I said, you don't have a gauge on your breast. You don't know visually, whereas with a bottle, you can see. And that can be really stressful for some people. Another big one is lack of support. And I think, in reference to the first slide where I showed throughout the world and all the different countries and who's breastfeeding and whatnot. And one thing in the US is really a lack of support. And because we have this, you have to go back to work right away, and don't feed in public, that's really embarrassing. And that just so many things that kind of set families up for it being more difficult. And a lot of places don't have good pumping facilities for women. And so, I'm myself, and I'm sure many of you as well, can tell stories about how I stood in bathroom stalls and pumped in my car, and as people drove by, and I saw way more than I ever wanted them to see. But the support is a really big one. And then lack of knowledge in healthcare providers, that's why I love this breastfeeding clinic, because we want you guys to be successful. And of course, there are situations in which maybe women don't want to breastfeed, and that's okay too. But please know that this is something that I'm very passionate about. The staff is passionate about, and we really want this for you as well. I just did my own segue. So good. Okay, so how and what we can do to help you be successful. So, like I talked about here within the clinic, so we have actually set up now for all first-time pregnant patients and or those who maybe have had breastfeeding issues in the past, that at around 34 weeks or so, you actually can come meet with me, and I will, if you don't have a pump already, I'll get you a pump ordered. I will teach you how to use your pump, how to clean it, sanitize it, all of that, and then talk to you like the one-on-one kind of how we can get started. In the hospital, then there is a lactation consultant there who tries to do rounds on all of her patients or all the patients, and she can assist you there. And then I like to see these people back again within usually about 1 week postpartum. So a one-on-one visit where you bring your baby, you bring your questions, and we just sit together and work on breastfeeding. Other lactation support in the community, so various pediatricians. There's all sorts of a couple other facilities are also trying to implement some breastfeeding support. So it is definitely out there. And then the family birthplace. Oh, so this I said is currently working towards a breast milk bank, but they actually have it now. So there you can, instead of having to use formula, say your baby needs supplementation for whatever reason, we actually have the breast milk bank there now, which is really, really awesome. And then immediately after birth, we put baby skin to skin with you. And this is really, really, really important at the time of delivery, because immediately that being that closeness together, the baby's able to initiate their own feed right away. And we prefer in the first 1 to 2 hours. And of course, things happen. However, the literature shows us that babies who go to breast within the first 1 to 2 hours after delivery are do better breastfeeding, have better breastfeeding outcomes overall. Okay. Any questions?
All right. Well, here we go. I've got a couple of things here from folks. First of all, I think it actually was maybe thrown up here as a little bit of a joke, Stacie, but somebody at the very beginning was like, chest feeding? So on that slide, it said breast chest feeding. Why is that word there?
Mm-hmm. And I do try to be better about saying both, but not all of our patients are identify as female. So we try to be very mindful of that. And so I do apologize if I didn't address that early enough, but yeah, that's why.
Yeah. All right. Great. All right. So you touched on it just a little bit there towards the end, but can you reiterate how a person can get a breast pump?
Sure. So what's really great is insurance will actually cover the cost of breast pumps. So we are set up here so there's a few different ways you can do it. You can go to various websites and purchase one, and they actually will bill your insurance for you. Or here we have a program within the clinic where we can get you set up. We have two kind of basic models that all insurance plans will cover. And so we can get you set up with one of those. The hospital also has a similar plan. So say somehow all of that got missed and you get to the hospital and think, oh no, I need a pump. Then they also can give you one and bill your insurance.
By the way, if you're watching live right now, you can still ask a question in the chat, and we'll have just a couple moments here at the end to get your question for you. And then where can people go for breastfeeding help locally?
So I did talk about this. So at the hospital, there's a lactation consultant there, and she usually can see patients up until about, I think it's a month. But the other thing, like I said, that we are scheduling all of our patients to come and meet with me. And so that way I can kind of start that groundwork early on. There are a couple other and you don't have to be a patient of Evergreens or have delivered, specifically with me or with one of our providers here to still come and see me for the services. And then Healthy Start. They all have breastfeeding, some IBLCCs, and other lactation specialists as well. And WIC, of course, too.
Okay, great. And then just working with you a little bit on the videos that we produce that everybody sees. I know how excited you and the other providers at Evergreen are to talk about the beautiful beginnings classes. I think there's some of, if not maybe a lot of what we saw in today's presentation is included in those classes. But can you, here's your chance to promote Beautiful Beginnings a little bit.
Yeah, so it is a provider-led, open to community, all community members, again, not just Evergreen patients, birth class, essentially. So we cover everything from just pregnancy stuff, labor, delivery, interventions at time of delivery, postpartum care, newborn care, and breastfeeding, and hospital tour as well. And it is, we have one a quarter. So we just started one last week, but you can join at any point if you'd like. And especially depending to when you're due and that kind of thing. And it's on Tuesdays at, what was it, 6, I think? Yeah.
I'm going to say, I think that's what you've said before.
I think that's what I said.
I'm going to say.
My portion hasn't come up yet this quarter, so I forgot.
But again, you don't have to be an Evergreen patient. You don't have to have a provider at Evergreen, and it's provider-led, which I think are some pretty unique characteristics, I guess, or benefits.
Yeah. And we started it, during COVID. We started, of course, doing it all virtually during COVID, because every class in town essentially stopped happening. And I think those classes are really important. You get to ask questions. You get to, gain a sense of community with other people who are going through the exact same thing you are. And it's just, and it can be a lot of fun too. And we really enjoy it. And we've gotten good feedback that our patients also enjoy it.
And you can meet your next new best friend.
Yeah.
Because you're at the same time.
Yeah.
I think my best friend and our moms met in something like that, and we were about the same age, and so that's how we met anyway. That's not about me.
Yeah, no, but it's so true, because
side of it, I guess.
With our first did a Lamaze class, and we met some other families in there, and we still, this is almost 15 years later, we're still in contact, so it's pretty cool.
Hey, and you can make best friends with Stacie Hanna too, if you want.
All right.
Any final thoughts that you wanted to make sure you mentioned?
I don't think so.
Okay. Well, you've covered a lot. It's not like,
And I feel like, sometimes doing these, it seems kind of overwhelming. I almost worry that it stresses people out more, like, oh my gosh, there's so much information, because I'm really just kind of touching on bits and pieces of the whole thing. But when it comes down to it, breastfeeding can be challenging, but that's why I'm here. Other community members are here because we do want to offer that support, and it can be really rewarding in the end too. So just at any point, if you want to just chat about it, I always love to talk about it. And a lot of times women do really well, but they, in their brains, somehow think that they're not. And they come and see me, and I'm like, no, let's just fix one little thing here, and they're doing great. So be kind to yourself, give yourself some grace. It's a brand new thing, and I got you.
Awesome. Stacie Hanna, nurse midwife at Evergreen Family Medicine. I feel like I always mess up your title every single time.
No, you're fine.
Nurse midwife, yes. Okay. And we will see you again in a couple of Thursdays. The second Thursday of every month at 4:00 is another Evergreen Talk right here on Facebook and YouTube for Evergreen Family Medicine. And as always, as well, we direct you to evergreenfamilymedicine.com for more information. Also, challenge accepted. I'm going to write the jingle for.
Please do. Please do.
I'll be in touch with you, and my agent, my people will reach out to your people. All right, Stacie, thanks again. It's always good to see you, and thanks to everybody out there watching Evergreen Talks. And if it is overwhelming, like Stacie just said, you can watch this back and pause it if you get overwhelmed and come back to it a little later on. So these videos will last online for apparently forever, according to what they say about the internet. So
Yeah.
thank you, Stacie.
Thank you.